There are a variety of terms that people tend to confuse. Community health, population health, and public health are three that come to mind that represent very different ideas, but nonetheless people just lump them together and they're quite different. I tend to focus on, community health is often thought of as a grassroots effort. It's a place where you get into the community, you work with people who are on the line, experiencing the challenge or the problem, and you help them to advance their health across a variety of dimensions. Health in the community is about healthy water and healthy eating. It's where the social determinants come in. If people are living in poverty or if people are living in a high crime zone, those are challenges to the community's health that need to be addressed. Population health, on the other hand, tends to reflect outcomes of care. And so, after the Affordable Care Act, many of us took a real approach to understanding pop health in the context of the ACO, the Accountable Care Organization, so really focused on outcomes of care for populations. The populations may or may not be segregated by the community in which you live. They may be based on age, so there are populations, ACOs that are driven for kids. There are ACOs, the most common ones are driven for Medicare recipients, but several have evolved for cancer patients or other specific diagnoses. And then public health is the construct of, where does the government fit in, whether it's local, regional, or state, or federal government? Where does their work crisscross with the needs and the responsibilities of other people who are informing the health conversation more locally? And given the different kinds of ways that you can organize the health construct, community health, population health, public health, the health system has a major role in two of the three, and probably contributes a little bit to public health, but not as much as with community health or population health. In community health, we would expect that both hospitals and health systems would be involved at the local level, understanding what the needs of the community are, and helping to advance better health. May not be health care, but influencing the way that people think broadly about the construct of health. In population health, we certainly are now, as a health system, being reimbursed even more obviously around how we achieve outcomes for broad populations of patients. No better example on the heels of the Affordable Care Act than understanding what our roles are as an ACO for addressing the needs of seniors. Public health is usually a government responsibility. But nonetheless, we're very important contributors to that conversation as we help to make sure that our water supply is clean and that our air quality is good. We have to not only be advocates for people in the community, but are the interface between government and the community as they advance public health measures.